Thank you for coming.
Yeah, okay.
Thank you for taking the
So
time. Let's start with
I'll
the
take
numbers.
it away,
Yes.
start with the numbers. Good noon to everyone. Hope everybody had a wonderful, safe, and sane 4th of July. Obviously, these last 2 weeks from a pandemic standpoint have certainly been incredibly active across the nation. California definitely becoming one of the hot spots from a state standpoint. And Tulare County, unfortunately, continuing to not lead the pack, but we definitely are up in the, we're a front runner, so to speak, in terms of some of the statistics that we're observing here in Tulare County, which I'll cover momentarily. So we have now, as a state, we have eclipsed the 5 million mark in terms of the number of tests that have been conducted, the number of COVID-19 tests, so not the antibody tests, but the tests to determine whether you have the virus or not. That's a good thing. We certainly are trying to increase our capabilities to do more and more testing across the state. So when I speak of crossing that 5 million mark in terms of testing, that's a positive thing. On the not so positive thing, but positively speaking, we have, of those 5 million tests that have been performed, 289,000 of them have tested positive for the COVID-19 virus. And unfortunately, we're always kind of looking back over the most recent 14 days because obviously this pandemic has ebbed and flowed in peaks and valleys since the beginning of March. We are now seeing, so we look over kind of, what's the most recent trends that really kind of serve as a barometer for the hospital in terms of what we might be expecting. So the state's reporting that in terms of the positivity rate, that is that the percentage of the tests they're performing that are in fact testing positive, the state is seeing a continuing upward trend in that positivity rate. We are currently running at the state level at 7.1%. So that's a pretty big hike from just the low 4% that the state was reporting just a few weeks ago. Hospitalizations are also trending up over that same 14-day period, and I'll bring that to home here pretty quick. Interestingly, and you've heard me talk about this at our past sessions, is that now exactly 2/3 of all those people that have tested positive are less than 50 years old. So I think we're still seeing a majority of the folks that are being hospitalized tend to be older, 65 or plus. But definitely what we're seeing again across the nation is that increasing number of positive cases appears to really be breaking out in the younger population, which are probably more active socially and out there, maybe not being as vigilant and wearing masks and hand washing and avoiding social gatherings. So no real surprise that that's where we're seeing the largest outbreaks. Sadly, of those 289,000 people that have contracted the virus, almost 6,600 have now died. 95 of them were frontline healthcare workers. And we're kind of at an all-time high in terms of the number of Californians that are currently in the hospital right now with the COVID virus. We're at 6,100. And roughly a little less than a third, 29% of them, or 1,800, are currently in the ICU. I do not know what percentage of those are actually ventilated that have been intubated, but it'll probably be similar to our numbers I'll speak to in a second. So coming down to the county level, as I mentioned, Tulare County is running fourth in terms of number of positive cases per 100,000 population. So almost 500,000 people live in the county. We rank fourth out of the 58 counties in terms of having the highest number of cases per population. And then also we rank third out of those 58 counties in terms of having the highest number of deaths that are COVID related for that 100,000 population. So we now are at 5,300 positive cases in Tulare County. We have 148 deaths, which gives rise to that, that third place among the 58 counties. On a very positive side, 3,500 of those 5,300 have now fully recovered. So that's a really good thing, and we are seeing obviously a much higher percentage of folks are recovering from this virus, but it's important. I was reading the other day that that the death rate might be somewhere around 1% cumulatively, and meaning that 99% of those people that are infected don't die. But 1% is a huge number. It's in the hundreds and hundreds of thousands of people across the country, and while the 99% may not die, the effects of the virus and all those that were hospitalized can tell you about their experience that unfortunately it's a very difficult virus to overcome. And so I don't want folks to believe, you know, that given the percentages are so low that somehow that makes you you know, less vigilant in those practices. So 3,520 recovered, 981 are still actively under management by the county. They're still quarantined, and the county is keeping a watchful eye on them. Just real quickly, of those that have tested positive, again, we're seeing a high percentage of them in the younger population, 616 less than 17 years old, 803 between that 18 and 25, 1,433 between 26 and 40, about 1,700 between 41 and 64, and only 777. So of the 5,298, a little less than 800 are actually age 65 and older that actually contract the virus. But again, the majority of deaths and hospitalizations tend to be that older population. Right now in the county, and again, just two hospitals, Kaweah Delta and Sierra View, that are actually taking care of COVID positive patients. There are 78 patients that are hospitalized between the two hospitals, 10 of them in the ICU, 9 of them on ventilators. I know there's a lot of questions and confusion and frustration around, again, what we call that positivity rate. So last Friday, just the day before the 4th of July, I participated in a county-sponsored press conference. Myself, Donna Hefner, who's the CEO at Sierra View Hospital in Porterville, Tim Lutz from the County Health and Human Services Agency, Amy Sheklian, who's the board supervisor for our district, the district in which the hospital is located. She kind of you know, sponsored the event. Sheriff Mike Boudreau was there. We had an epidemiologist. But we spent a lot of time talking about that positivity rate. And interestingly, the county actually put up a slide that showed what the positivity rate has been almost since the inception of the pandemic. And they showed that at the time of the press conference, the most current positivity rate across the entire county, they were reporting at 8.4%. But on that same day, I actually went to the California website, ca.gov.covid, I believe it is, and there's a map of the state, and you literally can drag your mouse over every single county and click on it, and up will pop a page that will give you the latest statistics about that particular county. And so if you, on that same day that the county was reporting 8.4%, the state was reporting that Tulare County was at 13.2%, a very significant difference. And so I spoke to Tim about it, and he was aware of the huge discrepancy. And what he told me is that unlike the county, who, and I know this is one of the questions that came up, so I'm kind of getting out in front of it a little bit, but Patients get tested over and over again. Somebody comes in and they test positive, and then they might be tested a few days later to see if they're negative, but they're still positive. And you might have a patient that over the course of their treatment, over some period of time, they may be tested 4 or 5 times, still waiting for that final negative test that clears them. So the county, and I personally confirmed this with them because this was a concern that we had initially too. We were kind of hearing some of the same things that the community was hearing, that maybe they were counting all 5 of those tests and all 5 of them being positive. But they assured me that they only count that one person, and they only count that one positive test. So it could mean that they don't count the negative tests that will occur down the road too, but they only count each person and only that one test. However, Tim said that the state, though, is counting every single one of those tests. And so if one person tests positive 4 times, that's 4 tests and 4 positives for a 100% positivity rate. And so that's why, and he says that he's been trying to work with the state to help them understand how that is grossly distorting the numbers that they're reporting. But, and I share that frustration. The state should not be doing that. It is a distortion of the facts. So, I do like the state website. It does give a lot of great information, and you can look at any county you want to up and down the state and compare counties and so forth. But I will tell you that Kaweah Delta, we do our own testing, and we have collected thousands of specimens and have performed thousands of tests. And so right now, of all the people that Kaweah Delta is testing, our current positivity rate that we're seeing here is running at 11%. Now, we generally only test symptomatic patients, although we do test all patients that are coming in for elective surgery, and they're generally always asymptomatic, and for the most part, they always are negative. So we might be a little bit skewed, having an 11%, because we tend to, again, focus on those that are symptomatic, more likely to be positive, where the commercial labs in the county and the county lab may be doing more asymptomatic and end up with more negative. So I'd say that in all likelihood, for the general population of the county, we're probably in that 10% neighborhood of a positivity rate. And then lastly, just wrapping it up, what's going on at Kaweah Delta right now. So the acute medical center, right now we have 333 beds if you exclude maternal child health, so mother, baby, labor and delivery, where we put our pediatric patients, the nursery and so forth. So really those that are available for adult patients, 333 beds, and 301, or 90% of them, are full today. And we have 53 COVID patients that are in-house. So of those 301 patients that are currently in the medical center, 53 of them are here because they are COVID positive. 19 of them, so about a little more than a third, are in critical care, either in the ICU or the ICCU. And then when I look at just say the 4 units that now are pretty much dedicated to taking care of COVID patients, which would be our ICU, 2 South, 3 West, which is an intermediate critical care unit. And then I think I shared with you a few weeks ago, we took our 12-bed pediatric unit and have completely converted that now to a COVID adult unit. So we still take care of children, but they are now, if they need to be admitted, they're being admitted onto the mother-baby unit. In terms of ventilators, we own 96. There are 44 that are currently in use. 6 of them are being used by COVID patients that have been intubated, which leaves us 52 that are open. So from a surge capacity standpoint, we're in pretty good shape. when it comes to ventilators, not such great shape when it comes to beds, and even worse shape when it comes to staff. We have had 170 of our healthcare workers that have contracted the virus since its inception. Again, fortunately, like many of those in the county, the vast majority have recovered. 105 of them have fully recovered, and many of them have come back to work. But still, we have 64 that are still they're quarantined at home. The vast majority of them are nurses, RNs, LVNs, certified nursing assistants, and obviously that's what's having the biggest impact on us from a patient care standpoint, and when I mentioned staffing. And we still have one of our employees that is hospitalized. So those are the latest
Okay.
stats.
All right, thank you.